Julie, thanks for coming in today. I appreciate you coming to share your story with myself and the viewers on the Cancer Stories programme. Let's get straight into it, if you don't mind, about what's happened to you from 2009 onwards. How was your cancer picked up initially?
I went with quite a positive attitude for screening, as most ladies do. My first ever mammogram in my life, and it came early. On the NHS, they normally are given, I think, at age 50. I actually made a joke with my colleagues about it. I remember very vividly saying, wow, mine's come early, I'm only 49, why am I being sent for? Happy birthday. So I go for the mammogram, and I'm not expecting a bad result. There was no history of breast cancer in my family. I self-examined regularly, I didn't find any lumps. Then I was recalled. I still didn't have any concern until I actually got to the appointment at the Glenfield in Leicester, and I realised I was in for quite a long appointment. The mammogram had picked up changes in my left breast, and basically I spent about 4 hours there having various mammograms, ultrasound, a punch biopsy, a core biopsy at the time, which was a very painful process, I have to say, being completely honest. And then I left, and I was told that they were dealing with possible cancerous area, but they didn't know how much. On a negative side of the visit, I was told by a doctor who I later nicknamed Dr. Blunt because it was a variance of her name. When I asked the question, what would happen next, meaning what would happen next at that appointment, because I'd had various tests, there was no literature to tell you what to expect. Unfortunately, it doesn't tell you that you'll be in clinic, you'll have an ultrasound, you'll have a biopsy. For all I knew, to all intents and purposes, I could have been hoiked off somewhere else and had some surgery right there and then. So I asked the obvious question, what happens next? To which I was bluntly told, well, we don't leave it in there, it's got to come out. Which obviously I understood, but I thought that was a little bit full on, you know, to be treated that way in a very emotional situation, because I call it the 11 o'clock appointment now, which adds humour to what was a very traumatic time for me. I remember sitting in a room with my twin sister with me, so obviously we were very close. She was opposite me as the clinician was telling me that actually there were changes in the left breast. And at the time, my husband, in a small room with a clock face looking at me, and I could hear her words that were relative to me, saying, well, actually, you've got, you know, breast cancer. And it was 11 o'clock. So I've never forgotten that moment, and I don't think most cancer patients do, because it's one of those massive moments of your life, for the good or the bad. And I call it the 11 o'clock appointment now, to try and joke, because obviously that's the only way I could get around it, you know, move on. All kinds of thoughts go through your head, really. Am I going to make it? What are the treatments going to be like? Am I going to be physically disfigured? My first thought was my daughter, who was only 8 years old at the time. How will she cope? How will I tell her? I think it's a very difficult thing to go through, because nobody can ever prepare you for that moment, because everybody hopes they'll never have to deal with that. And because of that, it doesn't matter whether you've got close family with you, or how happy you are in your life at that time, or how unhappy you are at that time in your life, it will be something that is a massive thing to deal with. But I think I've proven, being at this stage now, 5 years on, that, you know, you can get through it. Yes, there are things to go through. I think you learn to deal with things in different ways. And I've learned some very useful things along the way, which hopefully I can share with you right now on the video.
That's good to hear.